Thank you. Good evening, everyone. Sorry about the slight delay we had in starting. Welcome to another knowledge-packed full session with Khan. Today in our Healthy Heart session, our guest speaker is going to be enlightening us on how we can use our diet to combat a very, very peculiar hormonal condition in women. Now, this condition is known as polycystic ovarian syndrome, popularly known as PCOS. It is thought to be very common as it tends to affect 1 in 10 women here in the UK, and most of these women do not even have symptoms. Now, evidence has shown us that women with PCOS often suffer from fertility issues, and they're also at a very high risk of developing like other serious health conditions, such as either type 2 diabetes, even gestational diabetes, if they do tend to take in, and some other cardiovascular diseases. Unfortunately, there's no cure for PCOS, but to reduce the risk of these complications, it can sort of be managed with our diet. Our guest speaker, who is a registered dietitian, Dr. Hanifat Ibikunle, is going to give us more insight on this hormonal condition and how we can manage it with our diet. So please bring all your questions. I personally already have lots of questions to ask because this is a very interesting topic for me, something that I'm very keen on. So please pop all your questions into the chat box, or you can unmute your mic if you've got any question to ask, and our dietitian will very much answer those questions. So Dr. Hanifat, over to you. Thank you for joining us.
Thank you, Sylvia, for that introduction. But unfortunately, I'm not a doctor.
Okay.
Yeah, I'm not one yet. I'm just a registered dietitian.
Soon in
Yeah.
advance.
Yeah. Thank you for that. Thank you for that, beautiful. Can I just share my screen now?
Yes, that's fine.
Can everyone see my screen?
Yes, I can see your screen.
Yeah. All right. Thank you. Thank you. Like you've rightly said, my name is Hanifat Ibikunle, and I'm a registered dietitian. I currently work in the Primary Care Network. I've worked in the acute setting and the mental health setting in the NHS. So I currently work in the primary care setting. So PCOS and dietary management, like Sylvia said in our introduction, it is a complex hormonal issue, and it affects a lot of women right in the UK and all over the world. And some are not even aware of it because, as you know, they don't have diagnosis of it. So let's just go through it and let's see what we can do. And like she rightly said, it doesn't have a cure, but we can manage it with our diet and our lifestyle changes. So let's get to it. So I'm focusing on Black women because I believe this program is basically for Black women. So we'll be looking at what PCOS is. It's just a complex hormonal disorder. It's usually affect how a woman's ovary work, and it's just the cause is unknown. The cause of PCOS is unknown, but it's related to abnormal hormonal levels. It's just so I'll be doing this presentation. We explore the latest research on PCOS prevalence, dietary consideration, and successful management strategies for this underdeserved population in the UK, because the Black population is underserved population in the UK. So these are the prevalence of PCOS in the UK, Black and African population. So PCOS is estimated to affect up to 1 in 5 Black women, African women in the UK, which is a significantly high rate compared to the general population that we have in the UK. Then studies have shown that the Black African women tend to develop PCOS at a younger age, that's the late teen to early 20s, and experience more symptoms, including insulin resistance and fertility issues, irregular period. Those are what they usually experience. And socioeconomic factor, dietary habit, and genetic predisposition contribute to the disproportionate burden of PCOS among Black African women in the UK. So looking at the clinical diagnosis of PCOS, so we have three major diagnosis that if you have at least two of these, then they can diagnose you to have PCOS. We have the androgen excess. The androgen excess is having too much male hormones. We call them male hormones, like on facial, bodily hair, facial hair, acne, elevated testosterone, after excluding other potential causes. Those are called male hormones. Those are the ones that they're usually caused by androgen excess, and they're usually like male hormones. You know, you have excess hair, you have bodily hair, like you see some women that they've got body hair like they're men. These are symptoms of PCOS. Then we have irregular menstrual cycle or absent. Some people do see irregular menstruation, like they see their periods maybe once in every month. Some don't even see it at all. Some can go a year without having a menstrual cycle. So that's a major red flag for PCOS. Then we have the polycystic ovaries as well. This is usually checked by an ultrasound scan. So these are, like I said earlier on, if you have two of these features, then you're likely to be diagnosed with PCOS. At least two. Two must be present for them to diagnose you for PCOS. So looking at the pathophysiology of PCOS and its link to diet, because basically, I don't want to bore you too much with the clinical or the diagnosis of PCOS. What we're really focusing on is the dietary part of it. That's the nutrition part of it, because like we earlier said, PCOS does not have a cure, but we can only manage it with a good diet and a good lifestyle. So PCOS is a complex hormonal imbalance that is closely tied to diet and nutrition. Your diet, your nutrition, it has a lot of things to play in PCOS, because there's no cure for it, but with diet, with a well-structured diet, with a well-structured nutrition, and with exercises, then you can live a normal, healthy life. Because the excess production of androgens, such as the testosterone, combined with insulin resistance, can lead to irregular menstrual cycles, acne, excess hair growth, and difficulty losing weight. So research also indicates that a high diet in fiber, carbohydrates, and unhealthy fats can aggravate these PCOS symptoms in Black women. We know what refined carbohydrates are. Those are like having white bread, white rice, having sugary food, having white rice. Those are refined carbohydrate, pastries, snacks, sweet, chocolate. They are refined carbohydrates and they are not healthy. And we usually have the unhealthy fat too. We call them the saturated fat. The saturated fats are the one you see in pastries, the one you see in snack. Those are saturated fat. Then we have the importance of healthy diet for Black women with PCOS. Like I said earlier, when PCOS cannot be cured, but can be managed effectively through lifestyle changes. So we usually recommend a nutrient-dense. When we mean nutrient-dense, it's not just about you eating, but it's about you eating a meal that is nutritionally balanced. What we mean by nutritionally balanced is having the micronutrient and having the macronutrient in your meals. So some people eat, but they eat just calorie-dense food, like eating chocolate now. It's calorie dense, it's high in fat, and it's calorie dense, but it doesn't it doesn't contain all the necessary nutrients that the body needs. So there are a lot of empty calories food that we eat, but in terms of when you have PCOS, you have to be intentional. That's the word. You have to be intentional about your diet, and you need a nutrient dense diet, which is rich in all the micronutrient and the macronutrient that the body needs on a daily basis. And we all know that based on our individual needs, we need different caloric expectation per day based on our age, our weight, our goals, it depends on whatever it is. It is usually like an individualized diet. It is what you need as an individual. I might be needing a 1,005 calorie per day. Someone else might be needing a 2,000 calorie five per day. So it depends on your body structure and what our focus is. Some people might be trying to lose weight. Some people might be trying to gain weight. Some people might be trying to, so depending on individual preferences, that really determine the amount of calorie that we'll be having in a day. And like I said, a nutrient-dense diet is very important. A low glycemic diet is critical for managing PCOS symptoms in Black African women. So this can help to reduce the insulin resistance, regulate menstrual cycles, and improve our overall metabolic health. And when we mean insulin is resistant, we're trying to say that insulin is an hormone that is being produced by the pancreas. And in PCOS, the hormones are not in PCOS, the amount of insulin, the body tissue are not resistant to the effect of insulin. So the body usually fights itself to produce more hormones, more insulin, and that can lead to insulin resistant. And there's usually having insulin resistant too, you can actually gain more weight. You can get more body fat from it. And with PCOS, it might be difficult to lose weight. But while you're trying to manage PCOS, by losing even 5% of your body weight, then it can really, really improve your health. So these are the latest research on dietary intervention for PCOS in the UK. So there's the recent research study shows that a low GI, the one I've said, low glycemic index diet, the Mediterranean style diet can significantly improve insulin sensitivity and reproductive outcomes in Black African women with PCOS in the UK. Increasing our fiber intake, particularly from whole grains, fruits, vegetables, has been reduced inflammation and restore menstrual regularity in this population. Then we have supplementation too with inositol, and vitamin D has also demonstrated promising results in managing PCOS symptoms and improving metabolic markers in Black African women in the UK. So when we talk about the micronutrient concentration for Black women with PCOS, we're talking about carbohydrates. Like I said earlier on, I said low glycemic index. So when we mean what glycemic index is just to know what makes your blood sugar high, what makes it moderate, and what makes it low. So we have the glycemic index is usually like from 0 to 100, and the low glycemic index are usually from 55 below. But it's not all low glycemic index food that are quite healthy. Like, for example, we have chocolates. Chocolates have low glycemic index, but because of the high fat in it and high calorie, they might not be a part of an healthy diet. And for example, we have baked potatoes. Baked potatoes have high glycemic index, but baked potatoes are quite healthy. They are quite healthy because of the fiber in them. They're healthy and they're good. But in case of maybe like having potato crisps or something, those are high in fat and salt, but they've got moderate glycemic index. So in looking at low glycemic index food, there has to be a balance, because it's not all low glycemic index food that part of an healthy diet, and it's not all high glycemic index food that are bad. I don't know if I'm making sense with that, but we just have to have a balance, because balancing is what is really important in all our diet. We need to make sure that we're having the appropriate portion of the micronutrient, and we need to make sure we're having the appropriate portion of the macronutrient. And the examples of the low glycemic index food that we have the whole grains, we have the legumes, we have the basmati rice, we have bulgur wheat, we have quinoa, we have beans, we have lentils, we have fruits, we have vegetables. There are a lot of them that we've got that the releases energy into the system slowly, and that's why they are called low glycemic index, because they don't shoot up your blood glucose levels. And because one of the complications of PCOS is diabetes, is insulin resistant to insulin. So that's why someone that's got PCOS needs to be careful about what they eat, especially things that is going to shoot up their blood glucose level. That's why it is important that they take low glycemic index food, because it slowly releases energy into the system and it's maintain the blood glucose level. But like I said, there's still some high glycemic index foods that are good too, but we need to have a balance. Then this can, like I said, this can help manage insulin resistance, a key driver of PCOS symptoms in Black women. Then we need to be careful. We need to also look at the protein that we eat. We look at the lean proteins like chicken. In chicken, it's good to deskin the chicken. Your turkey is good to have them deskin, because you don't want to be taking the extra fat from them. We want to be eating the main protein. That's the white chicken, the white beef in them. Then we can look at the fish like salmon, fish like mackerel. They're good because of the omega-3 fatty acid that is in them. They're good. Then they support healthy weight management and provide the essential nutrients. So we need to aim for like balanced distribution of protein throughout the day, like making sure that you have protein in your breakfast, having protein in your dinner, and having breakfast and having protein in your tea time. We need to have, there's a particular amount of protein that it's recommended for individual based on our individual needs. It can be from 1 gram to 1.5 grams per day, depending on the kind of, if you're losing weight or if you're trying to add weight, like I said earlier on, depending on our individual needs. And we should try to just space it all through the day, make sure that we're having good protein and make sure that we're having it at all meals time daily. It's just making sure that we have a balance of all the nutrients that we need. And then the fat too, we need to make sure that we're getting all the unsaturated fat. That's the fat from avocado. Avocados are very good. Avocados have omega-3 fatty acid in them. Then from nuts, seeds, olive oil. Then we need to make sure that we limit saturated fat. In terms of nuts and seeds, they're high in fat and they're high in calories. So we need to be sure of the portion control we eat. Some people, they will tell you that they eat healthy, but they'll have a bottle of granules in their front and they keep munching on it. And before you know it, they've had more than what they're supposed to have in a day, because a bottle of granules could be you could have as high as 3,500 kilocalories, because nuts are very, very high in calories. So what we usually recommend in terms of not taking is just taking 1 hand feast. That's about 100 kilocalories, because if we're trying to watch what we eat, especially if you're on a calorie deficit diet, we need to be sure of what we put inside us. So your snack should be between 100 to 200 kilocalorie. Anything for more than that in snacks while you're trying to lose weight on a weight loss diet, on a calorie deficit diet, then you're taking more than what you're supposed to be taking. So we need to be, they're part of an healthy diet. They're good, but we need to be wary of the portion sizes we take. Like I said, portion is very, very key, especially when we're trying to be on a calorie deficit diet, or when we're trying to lose weight. And in PCOS, like we said, research has shown that even if it's just 5% of our body weight we're able to lose, it helps with the PCOS symptoms, and it helps our overall health in terms of PCOS. So that's why losing weight and making sure you eat healthy is very, very key. And then we need to be sure that we're taking enough fiber too. There's a normal recommended fiber intake that we're supposed to be having in a day according to our age, according to our daily recommendations. So we're supposed to get that from our fruits, our vegetables, our beans, our lentils. We get enough fiber by eating potatoes with the skin. We get fiber from them by eating whole grains. Then we have some cereals that have been fortified with extra fiber. It's just being intentional. Another way we can be intentional with our food is checking food labels. This country that we have has helped us because we are in a developed country. So majority of our food is being well labeled, and majority of them, they are like 99% trusted. So you can check what you are buying, what you're having in your food by checking your canned vegetables, your frozen vegetables. You can see whatever it is they contain. You can go for the ones that have got high fiber in them, healthy protein, healthy carbohydrates. By checking food labels is another way that we can be sure that we're getting what we're supposed to be getting. So that's basically it about micronutrient. Then we go to the macronutrient. Like in PCOS, it is very, very essential for us to have supplementation. So research has shown that many women with PCOS have low vitamin D levels, which can contribute to insulin resistance and fertility issues. So, and supplementation may improve metabolic and reproductive outcomes. So what we can do is, now that the summer is here, we can go out before the sun, before 10 a.m. in the morning. I think that's the best sun to get your vitamin D from. Then you can also supplement. What is recommended for PCOS is 1,000 IU to 4,000 IU maximum in women with PCOS. So vitamin D is very, very important in women with PCOS. Then we can also get vitamin D from our food too, from our dairy products, from our milk, from our eggs, from our yogurt. A lot of food that's got vitamin D and calcium in them, and they're good sources for us. They're going to add to our vitamin D needs. And according to research, we Black women, we don't absorb vitamin D like other skin color. So that's why even if we don't have PCOS, we should make sure that we're getting enough food that have got vitamins D in them. And if you know you're not getting enough, then it is good for you to supplement, even if you don't have PCOS, because they're not getting as much vitamin D like other skin color. Another supplement that is very, very important in people with PCOS is inositol, and the most important one is myo-inositol. This is usually recommended for people with PCOS. It helps them with fertility. It helps them. Some people actually believe that inositols help with weight loss, but there's no research to back that up. Some people use it for weight loss, but there's no research to back it up for now. But definitely it's helped to enhance the insulin sensitivity in Black women, and it helps with fertility, and it's just a great supplement for people with PCOS, especially Black women with PCOS. Then, like I said earlier on, the omega-3 fatty acid are very, very good. We can get them from fish oil, from algae. This helps to lower inflammation and improve menstrual regularity in Black women. We can get fish oil. We can get it from our salmon, from our fish, our mackerel, from our nuts, from our seeds. From our avocados. Avocados are very good sources of omega-3 fatty acid, but we need to be careful of the portion we eat in terms of avocados, because avocados have healthy fat, but they are high in calories. So if you want to eat avocados, the portion a portion is just 1/4 of an avocado. So if you're eating avocado, you're not supposed to eat the whole ball of avocado at once. Just take 1/4, because the whole ball gives about, depending on the size, it could be as high as 300 and something kilocalorie, and that's a lot of calories. It could be as high as 400, depending on the size. So I usually recommend just take 1/4 portion of the avocado at a meal. You can now spread it all over the day, but they are good sources of omega-3 fatty acids. They're good for everyone. They're good for kids as well. So they're a good source of omega-3 fatty acid. We can add them to our diet. Then for antioxidants is very important too for women with PCOS. We have like berries, we have green teas, we have spear meat teas as well. They help with androgen levels. It helps to reduce it, and they're usually green teas, spear meat tea. They're usually calming. They help to calm our nerves, and they help to calm our muscles. So it's usually good for people with PCOS for them to relax. For relaxation is good for them, and it helps to reduce the stress and improves the ovarian function in Black female with PCOS. So apart from diet, our exercise and lifestyle changes is usually very good as well. Diet is a very, very important part in managing PCOS. Like we all know that PCOS does not have cure. So we just need to manage it with our lifestyle. That's why diet, nutrition, and exercise, lifestyle changes is very, very important. And another thing that is very key is adequate sleep. I'm thinking the majority of us to hardly have 7 hours of sleep, especially in the UK. I know a lot of people don't sleep. I don't know why. it's just difficult to get that 7 hours, but
Very, very true.
yeah,
Yeah.
but it is essential. It is very important, not just with people with PCOS, but everyone in general. We need to be sure that we're getting at least 7 to 9 hours of sleep. That 9 hours might not be possible, at least the minimum 7 hours of sleep per day, because the sleep deprivation can have negative impact on the hormones and overall health. We need to know that PCOS is usually affect hormone, like there is an abnormal hormones. So anything that is going to aggravate the hormones, we need to make sure that we try to avoid it. And that's why we need to sleep very well, because it's just PCOS is just abnormal hormonal levels. So whatever you know that is going to aggravate it, it's better to just make sure that you don't move close to it, you just avoid it. And sleep is one of the things that, even if you don't have PCOS, normally if you don't sleep well, by the time you wake up, you feel cranky, it's difficult for you to start your day, you feel lightheadedness. So there are a lot of things that sleeping do to our body, but majority of us do not take it serious. So we need to make sure that we're sleeping well, PCOS or no PCOS. Then we need to make sure, well, for people with PCOS too, they need to make sure that they incorporate stress reducing activities, which is very important. Yoga is very, very good. Yoga is relaxing. I'm sure the exercise and coach, the fitness coach can talk more about this. Yoga is very, very important, because I believe yoga just have a lot of things that it does with the hormones. Yoga help to relieve stress. It helps with our muscles. You feel relaxed, you feel at ease. Yoga is just something, and meditation too, breathing exercise, a lot of things that it can do to our hormones. Our body just has a way of telling us things. And by the time you see that you're doing this thing right, you see the improvements. The research has shown that if you're doing what you're supposed to do, you will see lesser symptoms of PCOS, and you will live a normal, regular life. People do give birth with PCOS. People do normal things with PCOS. So it's not like if you are diagnosed with PCOS doesn't mean the end of the world. It's just you taking control, taking charge of your health, knowing what you're supposed to do, identifying the red flags, identifying the triggers, and knowing how to help yourself. I think that's what basically we need to, like an exercise. Exercise we can over we can we need to just know that exercise in everything, exercise, 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 exercise. I usually encourage my patient that whatever exercise you're able to do is better than no exercise. Even if you are bed-bound, bedridden, you can still do some form of exercise at your own level, at your own pace. But the thing with exercise is consistency. If you are not consistent with exercise, you're not able to get the benefits. You're not able to get the full benefit of exercise. So exercise is what we need to incorporate in our daily lives. We need to focus about 4 to 5 times weekly, and we need to be consistent about it. Not just with people with PCOS, but for everyone, exercise is just good. Exercise, the benefit of exercise is just amazing. And you will see that by the time you are regular with it, by the time you do whatever you're doing regularly, consistently, you see the changes. You can do brisk walking. I'm not good at the strength exercise, but I could walk. I could walk for 1 hour. I could walk for 2 hours. That's my own strength. So what you need to do is just to identify what works for you, what exercise you can do that is going to work for you, and what exercise you think that if you do them, it's going to be part of you. You're going to enjoy. Strength training too is very important if you can do it. If it's what you can tolerate, you can get yourself registered in a gym. You can get a personal trainer, because this improve insulin sensitivity and it helps with your overall well-being. So exercise, exercise, exercise is very, very important when managing PCOS. So these are the long-term complications of PCOS. So if you are unable to manage your PCOS very well, we all know that PCOS does not have a cure. So there's usually like complication of PCOS. We all know from what I've said earlier on that type 2 diabetes, like up to 50% of women with PCOS develop type 2 by the age of 40, as early as 40. especially when it's not being managed well. But if you manage your PCOS with diet, with nutrition, with exercise, with whatever you're supposed to do, then it might just be, you might not get the type 2 diabetes. But even if you get it, you might be able to manage it well if you're doing what you're supposed to do. Then we have the endometrial cancer as well. This is there's usually an increased risk for you to have this if you do not manage your PCOS very well, because it can be due to lack of ovulation and resulting. So you might end up having this. And it's also another complication is the cardiovascular disease. Women with PCOS have a higher risk of developing cardiovascular disease, high blood pressure, dyslipidemia, chronic heart diseases. There are a lot of cardiovascular diseases that is attached to PCOS. PCOS can come up with a lot of complications if not well managed. If not well managed, then it can even affect your mental health, because by the time you're having these red flags today, you're having these flashes today, you're having that flash to do tomorrow, it might make you depressed, it might make you feel anxious, then it might give you other mental health issues. You might start having maybe other disorders, having suicidal thought, thinking your life is the end of the world. But it's not, like I said earlier, when it's not the end of the world. It's just how you are able to manage it. There's no cure for it, and we don't even know, the cause is still unknown. The cause is still unknown. And you're at higher risk of developing PCOS if you have the family history. So it's been linked to genetic. If like your mother has got it, or your auntie has got it, or your sister has got it, then there's high chance of you having PCOS. And it's common. We can see that from the research, 1 out of 5 Black women in the UK have got PCOS. So it's a common hormonal disorder in women. So it is what we need to get more research on it. It is what we need to talk more about it. It is not something to be shy of, but it is how well we are able to manage it that is going to make us better at it. Do you have any question up to this moment, or I should just shoot on?
Thank you very much for that. I've got questions, but I think I'll keep mine at the end. But has anyone got any questions, anything that they'd like to clarify? Any questions at all before we conclude? You can pop your questions in the chat box, or you can unmute your mic if you've got any question.
Is there any research going on to find out a cure for this PCOS?
PCOS. Yeah, I can't be affirmative about that, but definitely there is research everywhere. There's research being done regularly, but up to now, there's no cure for it. The same thing for diabetes, there's no cure, but imagine the amount of research that has been done, that has been carried on every day, but there's no cure for it for you. So what we can do now is just to manage it. Like I said, dietary, it's very, very key in managing PCOS. That's what we can do. If you're overweight, losing weight, checking your BMI, checking that you are within the LD BMI. Yeah, your BMI has to be within 18.5 to 24.9. That's the BMI range for healthy weight. So if you're not in that range, then trying to make sure that you lose weight and being in the healthy weight, even if it's just 5% of your body weight you're able to lose, you see better improvement in your symptoms. But for now, there is no cure for PCOS. Research are definitely ongoing, but there is no cure for PCOS.
Okay.
What is the full meaning, please?
It's called polycystic ovarian syndrome. Some call ovarian or ovary. It's usually ovary or ovarian syndrome. Polycystic ovarian syndrome.
Okay. Okay, I think I'll just ask a few questions now. So you, just like how you had earlier mentioned, and you said that the complications, 40%, some women have type 2 diabetes even before they get to 40 or at the age of 40. So is there a life expectancy for someone who has PCOS?
life expectancy for someone with, if you are able to manage your PCOS to me is like any other condition, any other disease condition. What makes it different is how you are able to manage your condition. For diabetes too, even if you don't have PCOS and you have diabetes, if it's not well managed, obviously there are greater complications of diabetes. Even with obesity, most health conditions do have these greater complications if not well managed. So if you are managing your PCOS very well, you can live a normal, long, healthy life. All you need to do is just to identify the triggers, identify what works for you, have a lifestyle changes. It's a general lifestyle changes. Yeah, okay. Just have a lifestyle changes and you will live a normal, regular life. Some people even have PCOS without not having symptoms, and some people have PCOS without not even being diagnosed, and they're not even aware. There's still a lot of people out there that are not diagnosed with PCOS and they're living normal life. They're having babies. They're not having fertility issues. They're having their period regularly. They're having
Yeah, I think that's leading to my next question, because I was going to ask and say, so most women who do not have these symptoms, is it safe to say that they will not have any of all these complications, like no fertility issues, nothing like irregular periods or anything? Is it safe to say that they will just go ahead and live a normal life?
Yeah, if they don't have the complications, they might live a normal life, because like I said, the clinical diagnosis is you have to have at least 2 of those symptoms: the irregular period, the androgen levels, that's the male hormones, the polycystic ovarians. So if you don't have any of those, at least 2 of that, then they might not be able to diagnose you with PCOS. But people might not have the symptoms and they're living a normal, regular life.
Yeah. Okay. Right.
So it depends. I think what we usually bring a lot of people out to their GPs is these symptoms.
Is the symptoms.
And yeah, if it's just a regular period that you have, it might just be like an hormonal thing. So you having an irregular period enough doesn't mean that you have PCOS. So you have to have at least one of the other one of the other clinical diagnoses to be able to diagnose that you have PCOS.
Yes.
Yeah.
Okay.
And sometimes you might not even have any symptoms. And they might just do a blood test for you, and yeah, so you might not have any symptoms and be living a regular, normal life. So I think it's just depending on your own. If you've got the genetic, obviously you have higher risk of it. Yeah. And I think we Black women too are at higher risk of it, because if you look at it, a majority of us usually have vitamin D deficiency, especially in the UK, because our body did not absorb a lot of vitamin D. So I think we just need to adapt an healthy lifestyle.
Yeah.
And because we Blacks are at risk of type 2 diabetes too, we're at higher risk of type 2 diabetes. We're at higher risk of high blood pressure. So those are, the things that they could make us be at higher risk of having a PCOS as well. So.
Okay, right. So in that, if that's the case, do people get born with PCOS, or does PCOS develop after? I know currently the cause is unknown and it's more genetics, but I'm just curious, is it that you say, oh, a child is born with PCOS, or does it develop after a certain period of time?
So it usually occurs during the late teens to early 20s.
Right.
Yeah, and it can be earlier in life. Okay, it might be close to 40, it might be, but it's usually early developmental stage, the 18, 19, early 20s. Yes, it's usually occurred during that period, but it doesn't mean that you cannot develop it later in life, like any other condition as well. You can develop them at any later, as long as you've been predisposed to it. Maybe you have the genetic in you, or maybe you have something like PCOS, because we don't know it's the cause is unknown. It's just abnormal hormonal levels.
Okay.
So because we don't know the cause, so it can occur at any time.
Right. Okay, I see. Okay. So if that's the case, now that we are aware that it can develop at any time, you can even get it after your teens or maybe later in life.
Yeah.
Is there a way to prevent it from occurring, or should we just, basically, is there a way to prevent it from occurring? Is there something you can do to,
I think the best way to prevent it is to live an healthy lifestyle.
Yeah.
And it's not
Actually,
just with PCOS, with any other condition.
that condition.
It's living an healthy lifestyle. We need to be intentional living, intentional. Excuse
Emphasis
me.
on that intentional.
Intentional. Like I today I want to have 2 portions to 5 portions of my vegetables and fruits. I'm going to make sure I have it. I'm going to pack my lunch. I'm not going to eat what I'm not supposed to eat. And when
Yeah.
when I'm even cheating, I know that I have to have like my limit of what I'm going to cheat on.
Yes.
Yeah.
Yes.
And especially when we're in certain age, it's not just about PCOS. By the time you get to certain age, moving to 40s, even if you don't have PCOS, there's high tendency of you developing type 2 diabetes because we've got the higher risk of it as black. So yeah, immediately before you start clocking those years, you need to take your health seriously. Be intentional about what you eat, be intentional about exercising, be intentional about getting the right amount of food in the right quantity based on your personal needs. And if you know that you have a condition you're managing, visit your dietitian to give you a diet plan that works for you.
Okay. Yeah. That's very true. That's good. Yeah. Thank you very much for that. So I think from everything you said, I think just to confirm, it's safe to say that if it's diagnosed at an early teen, if you get it from like an early age, do you think it will get worse over time if it's not treated and if you're not managing it? Do you think the symptoms or the complications will become worse over time, or they'll just be normal and things like that? Because I'm asking this question because I personally know someone who's been diagnosed for over 3 years now with PCOS, and I don't think she's paying attention to the complications, right? Because people sort of just believe that, oh, it's PCOS, there's no cure for it, there's absolutely nothing I can do with it. And also the fact that you try to lose weight, because I know it's also very difficult living with it, the fact that you're trying and trying to lose weight, and then most people tend to give up. So is there any evidence or anything concrete that we can let them know to say, see, over time it's going to get worse if you don't deal with it now? Is it possible that it will get worse over time with age as you grow older?
Yeah, one thing we need to realize is we can't force anybody to do anything. Everybody to their own individual. We can only encourage.
Sure.
We can't force anything on anyone. And what we want for our health, for our life is different. So I think that is really going to help an individual. Okay, I want to live an healthier life. I want to take my life seriously. I want to live longer for my kids. I want to, have so many things to do. So I think that enough is going to help one, taking your health serious. Yeah. But like I said, we're different people with different individual. So for someone that does not even, not wanting anything out of life, may God forgive me, they might not want to do anything. And sincerely, the complications might not come now, but it might come later in life. So
right.
So the only thing we can tell them now is just to keep encouraging them, especially when they're still. And for teen, if it's diagnosed earlier in life, it's usually not straightforward, because for teen, they're full of life. Okay, they're just coming up. So what do you expect? Yeah, you can only encourage them.
Sure.
You can only encourage them. I've worked with teenagers in this country and I know how it is. You can't force anything on them. They know everything. Yeah, they know everything. So you can only encourage them. You can only encourage them, pacify them, make them see reasons why they have to do this, why they have to do that. And that goes for everyone. So it's just an individual person thing. It's an individual decision that I want to have an healthier life. I don't want this condition to take a better part of my life. I'm going to get hold of it, and I'm going to get hold of my health.
and deal with it once
Yeah.
and for all.
Yeah.
Yeah.
And I think with the weight loss, it's usually more harder in PCOS because of the resistance to insulin.
Okay.
Because the body is forced to produce more insulin.
More insulin,
Yeah.
yes.
So
That's
it
very
makes it
true.
more harder, and by that way you're getting more body fat.
Body fat,
But
yes.
with lifestyle changes, it's going to be slow, but you will see the difference. It's just
Very
consistency.
true.
With weight loss, a lot of people are not patient.
They're never patient,
Yeah,
even when there's
yeah,
an underlying
yeah,
condition or there's no
yeah.
underlying
But for
condition.
a dietitian, if you are managing you're trying to lose weight, even if it's 0.001 weight
It's
loss you're
fine.
having in a week, I'm happy because I know it's a
I'm
lot.
happy with it. Yes, I
Yeah,
know
but
it's
a
a
lot
lot.
of people are not. They want the
No,
fast method, and that's why a lot of people end up, crashing because they are doing it in the wrong way. But the
true.
idea is to train your body to let your tummy know that this is the amount of food, to train our brain. It is whatever we train our
Yeah.
body and our brain, and that's what, it's going to be acceptable because you've trained your body, you've trained your brain to be able to accept this particular amount of food. And by the time, whatever you've done for at least 3 months, 4 months, it becomes a part of you. And
It
before you know
becomes
it,
part of you.
before you know it, you just find out that even if you go out and they give you a particular portion of food, you'll be like, no, I can't finish this.
I can't finish it.
You know what you're supposed to eat. You know what you're supposed to eat. You have
Yeah.
adopted to that lifestyle. And before
Yeah.
you know it, you're just an happy person living your life to the
Your life
fullest.
and going. That's very true. I think I'm personally I'm an evidence to that fact because I have trained myself in such a way that there are certain things that I don't go for. Carbs, I can only have 1 spoon of rice or 1 slice of bread. If I have more than that, I will not be able to finish it. Now, even if as it stands, everybody mocks me with it and laughs at it and everything. But no matter how I try, if I have 2 slices of bread now, that's the end. I will not be able to finish it. I will not. And I keep telling people, with having to lose weight or with having to add weight, it's how you train your body. Your stomach has the capacity to expand. It's what you give it over time. It will get used to it and it will accept it. So yeah, I totally agree. Okay, we've got a question in the chat box. Hazel is asking, would it be advisable to ask one's GP for a check for PCOS when you get your annual health checks? Do you
Definitely, but they would ask for your symptoms.
All right. Okay.
Yeah, they will ask for your symptoms, and if you're having like 2 of the symptoms we've said earlier on, then they're likely to diagnose you with PCOS. So it's good. I think in the UK, anything as long as you're 40, immediately you clock 40, you can request for a general checkup. And yeah, you could request for a general checkup as long as you're 40 in this country. Even if you're not up to 40, if you've got symptoms, just visit your GP and just know. Yeah.
I also feel like that's another issue, that symptoms. I feel like that's why a lot of women are not being diagnosed for it because they, just like you said, they will ask if you have symptoms. What now happens to the women who don't have symptoms? So that's the problem there.
Yeah, we need to understand that there's a lot of pressure on the NHS at the moment, and we're trying to cut costs as much as possible. So, and those tests don't come cheap. So you just have to have symptoms for them to take you serious. Yeah, majority of the things that have been taken seriously now are close to emergency.
Close to emergency, if not even emergency.
Yeah. Close to emergency. So because the pressure is just too much on the NHS.
Yeah, right. Okay, then no worries. Has anybody got any questions before I let Hanifat round up? Okay. Yeah, I think I can let you finish up, and then if anyone has got any questions, they'll pop in the chat box, so you can just unmute your mic.
Okay. So we just go to the conclusion and recommendations. Like it's just all what we've been saying since. Prioritize PCOS screening, ensure regular screening for PCOS among Black women as they are disproportionately affected by this condition. We are disproportionately affected, so we need to take it seriously. 1 out of 5 Black women in the UK have got PCOS. Then adopt a holistic approach. Recommend a comprehensive management plan that addresses exercise, stress, micronutrient, macronutrient supplementation for optimal PCOS control. Eat healthy, eat the low GI diet. Like I said, there's some low GI diet that are not healthy, like eating chocolate. They are not an unhealthy choice. So just having a balance. High GI diets like baked potatoes is healthy, but just having a balance. But the important thing is for us to focus on the low GI foods more because they slowly releases energy into the system. They do not shoot up our blood sugar. Like if you have refined carbohydrate, like it's like you giving a child a sweet or a fizzy drink. You know how they behave. They're everywhere and they're unstable. That's what happens when we have refined carbohydrate in our system. It just shoot up our blood glucose levels. And because of the insulin resistance we have as a PCOS, you need to just be wary of what you eat. Those refined carbohydrates, white flour, baked pastries, cake, sweet, added sugar, we do all know all these things. It's part of life. We're not saying that you cannot have them, but just have them in moderation. And, just know when it's okay, know when to say no. Know when to say no to those things. Yeah, know when to say no. They're part of life. You need to enjoy, but know when to say no. Like what I like about the British is they do take the sweets, but they take it in small portion.
Small portions.
Yeah, if they have the 3 square meal, we Africans usually just have large meals, and majority of our meals are carbs. They're very high in carbs, but what they do is they make sure that they have the 3 meals, they have the sweets, they have the main meals, and they have the starter, but it's usually in small portions. And at the end of the day, they're having their balanced diet and they're still enjoying their sweets, like the dessert they have. Even the patients I handle in care homes, 99, 100, they still love their dessert. They still like their sweet because they have been used to it. But it doesn't mean that it's going to affect because they take it in small portion. They hardly eat in large quantity. I think the only thing I could say they eat in this country in large quantity is bread and potatoes. I think that's a major staple food in this country. Yeah,
that's very true.
Bread. And if you look at it too, that's why they've come up with different varieties of bread. We have sour bread, we have sourdough, we have wheat bread, so you can, whatever it is that you want, you can always get what is good for you. For me, I take the low calorie wholemeal bread. It's just 55 calories per slice. That's nothing. And 2 of it is about 110 calories. So you just find what is appropriate for you. That's one thing about the UK. So it's just for you to identify, be intentional. I'm not going to go more than 1,002 kilocalories that I'm supposed to be taking. Be intentional about what you are feeding your body with. And you will see that you love it and you enjoy it. And you will see the difference in your health, in everything about you, your mental health to be stable, you will be more energetic and you will see your life, full of happiness. So just adopt an holistic approach. Be very intentional about what you're doing. They provide a culturally sensitive care, tailor PCOS education and treatment to the unique needs and preferences to Black, improve engagement and outcomes. Just tailor it to your needs. Know what you eat. Know what your food entails. Know what you have on your table. Have an exercise routine. You don't have to go to the gym before you can exercise. There are a lot of exercises that you can do on YouTube. I have a walking exercise that I do on YouTube and I enjoy it because I don't like exercise as well. But I just try to pick the one that I know that I will be consistent with. So it's just walking for 30 minutes, 35 minutes, and it does work. I'm like, I'm sweating. Oh, but you feel like you're not doing anything, but you're actually doing something. So a lot of information. I don't think there's any information that you don't have on YouTube. Is there any information that is not on YouTube? So there are a lot of things. So just look at what works for you. Just be consistent with it. You can set an alarm. Just be realistic with what works for you. If you know all you can do is just for 20 minutes, do it and do it well. Whatever is worth doing well. Do it and do it well. Just identify what works for you as an individual because we're not different. You can't compare yourself with another person. So just identify what works for you and just do it and do it well. And you will see that your health, everything, because PCOS, like I said, it is common. It is common. So we need to be wary of it and we need to know how to manage it because there's no cure for now. Then you can also collaborate with the community, go to local PCOS support groups, like the charity groups. the community organization, the awareness, just whatever information. There are people that you see them in the community, like doing like a group yoga, doing a group meditation section, just involve in whatever you think that is going to help you, whatever is going to help your mental health, whatever is going to make you be able to manage the condition well, based on your own personal needs. It's just about you. It is about you. It is about you. Just take it like it's about me. And I'm going to make sure I get whatever it is to be able to manage this condition very well. And just have a positive attitude at the end of the day. It's positive attitude that really makes everything works well for you. And we are Blacks. We've got thick skin and we're strong. We're strong will. We have great mindsets. Whatever we put our mind to, we try to make it work. So it's just making it work, and you will see that your life will improve. You will not even notice that you have the PCOS because you will not be getting the symptoms. So these are my references. Thank you. Questions?
Thank you. Thank you so much, Hanifat.
Yeah.
Thank you. I think
Welcome.
we've slightly gone out of time, so I'm not sure we've answered a couple of questions, so that's all right.
Yeah.
Thank you so much for helping us, for enlightening us on this PCOS and how to better manage it with our diets. Now, just like we had earlier said, it can be very hard living with PCOS, but now that we have more knowledge about it and that we are aware that it can be managed with diet and also our lifestyle, it will be much better to cope with it and to also help people who have it around us to also cope better. So thank you so much for joining us today.
You're
And
welcome,
I'll be
Sylvia.
handing over to Orlando. Orlando, are you ready? I'll hand over to you now. Thank you.
Just mute myself. Okay, can you just spotlight me, please, Sylvia? Thank you. There we go. Turn. Okay, thank you, Sylvia. Thank you very much. All right, people. I hope everybody is staying on for today's exercise session. Today, we're running through a box exercise session. So we've got a warm-up. We'll go through 3 rounds of combinations, then we'll cool down. For today's session, all you'll need is plenty of space and plenty of water because it's still quite humid outside, despite the little spells of rain that we've had. All right, so time's it now. Let's get straight to it. Let's start with our warm-up. Let me sort my music out. Here. Right, to get us into our session, we're going to start with a shadow skip for 30 seconds. Let's get ready now, people. We're going to go in 3, 2, 1. Let's shadow skip, everybody. Let's go. Keep that going, people. Keep that going. Keep that going. 2, 1. Okay, next. Left, right. Let's go. 30 seconds. Keep that going, people. 2, 1. Okay, now we'll go. Jab, cross, left, hook. 30 seconds. 3, 2, 1. Let's go. Three, 2, 1. Okay, rest for 15 seconds, people. 15-second water break. Okay, people, let's get straight back into our warm-up. So next, we've got high knees, okay? Alternate high knees. Get ready. 3, 2, 1, let's go. Keep that going, keep that going, keep that going. 3, 2, 1, next one, arms forward, let's go. And backwards. Loosen out them shoulders. Change arms. And backwards. One, to the hips now. Change direction. Last one, people. We've got uppercuts, 30 seconds. Let's get ready. 3, 2, 1, let's go. Let's go, people. Three, 2, 1, and rest, people. Okay, take a 20-second water break and then join me in the ring for round number 1. Well done. Okay, people, back to your spaces now. Let's get in the ring. Let's get into round number 1. Okay, so round number 1, we have a combination round. Okay, combination round. We're going to start off nice and easy. Okay, if you've been on these calls before, each round we do is a full boxing round. Okay, so for a full 3-minute round. For your first minute, we're going to look at strength. Okay, power punches. So we're going to be in our guard. I need 2 jabs. So double jab, cross, nice and hard. Put your full body into the punches. Remember, boxing, we're going from the ground up, okay? So we're generating our power and our force from the floor right through the full body. So watch again. Double jab, hard cross, nice and strong. Use the floor to your advantage. Double jab, cross. Okay, that will be your first 60 seconds. And then we will add to the combination. All right, people, let's get into it now. Come on. Let's get into it. So full body movement, double jab, cross to start off with. First 60 seconds. Let's go on the drop. In your guards, people, get ready. Get ready. 3, 2, 1, go. Now go, people. Halfway. You go. Hey. Double jab, cross. Keep it going, people. Two, one. Okay, let's pause the clock right there. Okay, let's add to it now. So we're going to add a left hook and another cross. So watch the full movement. Double jab, cross, left hook, cross. Let's go. Second minute now. 3, 2, 1. Put that together now. Let's go. Let's go, people. Halfway. Let's go, people. 10 seconds. 2, 1. Okay, pause the clock again. Okay, last minute coming up now. Let's add to it again. So we're going to add uppercut cross now. Getting a little bit tricky now. So watch the full movement slowly. So double jab, cross, hook, cross, uppercut, cross. Okay, double jab, cross, hook, cross, uppercut, cross. Last minute now, people. Let's go. 3, 2, 1, go. Let's go, people. Thirty seconds. Ten seconds. 3, 2, 1, and pause there, people. Well done. Take 30 seconds, take on some water, and join me back in the ring, round number 2. Well done, people. Okay, people, back to your spaces now. Let's get into round number 2. Okay, so round number 2, we have a pyramid round mixed in with legs. Okay, mixed in with legs. All right, so the punches will stay the same throughout the round, and the exercise will stay the same throughout the round. Okay, so we're going to be in our guard. It's a pyramid round. Turn this down a bit. There we go. It's a pyramid round. All right, so we're going to start off with 2 straights, 2 hooks, 2 uppercuts. And then you're going to pyramid each punch by 2, okay, up to 10. So next you'll do 4. So 1, 2, 3, 4. 1, 2, 3, 4. 4 uppercuts. Then you'll do 6 of each, 8 of each, and then 10 of each. Once you get to 10, you're going to drop down for 10 squats. Okay, 10 squats, we're here. 10 squats. Okay, once you've completed a full cycle, then you start back with 2 of each punch. So 2, then we go 4, then 6, 8, 10, and then back to your 10 squats. And we're going to work through the cycle for the 3-minute round. All right, people, let's get into it now. Come on now. Turn this tune back up now. Come on. Get some panel in there. Let's go. Okay, let's get ready. So start with 2, 2, 2, and 3, 2, 1, go. Now 4. 2, 3, 4. Now 6. 6, 2, 6, 6, 8 now. 2, 3, 8, 6, 7, 8. Now 10. 10. 8, 9, 10. So put my way up to 10. Now I've got 10 squats. Once you got your 10 squats, straight back into your 2, 2, 2. Work your way up to 10. That's halfway, people. Keep working through it now. Come on. Keep working, people. Come on now. Six. 8. 8, 10. 10. 10. 6, 8, 9, 10. Keep going now, people. 30 seconds left. Keep working through it now. Ten seconds. 3, 2, 1, and that's time. People, round 2 down. Again, take a 30-second water break. Join me for our 3rd and final round. Well done. Okay, people, let's go 3rd and final round. So our last round, we've got a conditioning round, okay? Cardio conditioning round. So there'll be a lot of punches being thrown over this 3-minute round, okay? So for the first minute, we're going to work on straights, okay? We're going to work on straights to the head. 30 seconds, nice and quick. Then we're going to go to the body. So we'll go down for 30 seconds. Then we've got 30 seconds of uppercuts. Nice and quick, nice and quick. Then we've got 30 seconds of body shots. So to the ribs, bang, bang, bang. And then for the final minute, making that heart work a little bit harder, we've got a minute of above the head. Okay, so watch again. 30 seconds to the face, 30 seconds to the body, 30 seconds uppercuts, 30 seconds to the ribs, and then 60 seconds above the head. Okay, people, work at your own pace, okay? Try and sweat it out now. Last round, this last round from your way, okay? Okay, let me turn my tunes up. Let's complete this round. Let's get busy, people. Okay. So you're gonna start with those straights to the head. Get ready. Going in 3, 2, 1, let's go. Keep that going, keep that going, keep that going. Halfway. Ten seconds to the head, keep going. 3, 2, 1, to the body now. Punch it to the body. Keep that going, people. Keep that going, halfway. Ten seconds. Deep breath, uppercuts, go. Keep going, people. 10 seconds. 3, 2, 1, to the ribs now, to the body. Keep going. 10 seconds. 3, 2, 1, above the head now, let's go. Chill out now, people. Keep going, people, keep going. Halfway. Keep going. 20 seconds left. Keep going. 5, 4, 3, 2, 1. And rest, people. Well done, well done. Take 30 seconds, take on some water, then we'll stretch up. Well done. Okay, people. When you're ready, join me back in those spaces. Let's stretch now. Starting up top, moving our necks side to side. Let's go. Up and down now. Okay, hands to the hips, torso twists. Next one, high knee to forward step. Go ahead, step forward and back. Okay, hip rotations. I'm back. Front and back to finish. And that's time. Shake it all off. And that's time, people. Well done. Big session. Well done. Before we finish, do you have any questions or any comments today? So feel free to unmute yourself. Everybody shy today? Anyway, people, well done tonight. Great session, great box exercise session. Hope everybody enjoyed the seminar previously as well. Make sure you join us again next week, 6:30 p.m. until 8, where the first hour is reserved for our informative seminars on various different topics, followed by an exercise session by me. All right, until then, people, have a great evening, a great weekend, and I will see you next week. Peace.
Thank you.
Thank you.